Welcome back to Psychedelic Therapy Frontiers, the podcast devoted to exploring the frontiers of psychedelic medicine and what it takes to cultivate a healthy mind, body, and spirit. I'm clinical psychologist Dr. Steve Thayer, and today my co-host Dr. Reid Robison and I are joined by Dr. Amy De La Garza. Amy is the Substance Use Disorder Program Director here at Novamind and the Medical Director of our Salt Lake City downtown clinic. Amy is a board-certified family practice physician who for the last 10 years has been providing specialized integrative healthcare for behavioral health, substance use, and a variety of other conditions. Amy joins us today to talk about all things integrative medicine. We talk about nutrition, exercise, sleep, psychedelics, substance abuse, eating disorders, hormones, the gut-brain axis, and much more. Amy is a treasure trove of knowledge about mental and physical health, and we plan to bring her back for a few deep dives on several of the topics that we just scratched the surface on today in this episode. As is customary, I'll shamelessly ask, maybe a little bit of shame, ask you to please rate, subscribe, like, and share the show if you find it valuable. Spotify has just added a new feature where you can give up to a 5-star rating on podcasts on that platform. So if you listen on Spotify, or heck, even if you don't listen on Spotify, go ahead and if you're willing and feeling generous, give us a 5-star rating on that app. It helps us get into the ears and faces of many more people. So thank you for listening. Please enjoy today's episode with Dr. Amy De La Garza. Welcome back to Psychedelic Therapy Frontiers. Today, Dr. Reid Robison and myself, Dr. Steve Thayer, are joined by Dr. Amy De La Garza. Hi, Amy.
Hello.
Welcome to our podcast.
Thanks for having me.
It's good to have you here.
Our pleasure.
Thank you.
So Amy is our medical director of our downtown Salt Lake City clinic and the director of, I wrote it down because it's new, the Substance Use Disorder Program, right?
Yes.
Okay.
You got it.
I got it. So we're excited to have Amy on the podcast today because Amy is a functional medicine physician. And we were kind of talking about before we hit record what the proper terminology would be for such a physician. Functional medicine, I've heard a lot. I've heard holistic medicine. I've heard integrated medicine. What
or
kind
integrative.
Integrative is there a difference? Integrative.
Integrative would be more common, I think.
Yeah, I think integrative is kind
you're
of
not fully
the
integrated, like fully self-actualized.
Yeah, that'd be quite the claim.
You're
right?
you're in the process of becoming integrated
I'm
by
an
being
enlightenment
integrative.
physician. Yeah.
Not an enlightened physician.
No. I'm a physician who evokes enlightenment in people. So what, for the folks who are listening who might not know, what are these terms referring to? How might you be different, or how might the patient experience be different if they visit a functional medicine physician or integrative medicine physician versus just going to their regular family practice doc?
Yeah, I think functional medicine and integrative medicine, sort of the two things that stand out to me that are different. Functional medicine is really incorporating Western medicine with a more functional approach. So looking at the human as a whole human rather than looking at diagnoses, right? So a person with cardiovascular disease, type 2 diabetes, and depression, we could, in a conventional setting, we could look at the diabetes and treat that with a medicine. We could look at the cardiovascular disease and treat that, and the depression and treat that, right? Mm-hmm. But really, in functional medicine, what is the root cause of all of those diagnoses, right? And how do we look at that entire human and incorporate their genetics, their prenatal history, their potential traumas, medical interventions, sort of all of the things that have happened on the timeline of their life that correspond to the different disease processes that they're showing up with, right? And so we use in functional medicine a functional medicine timeline to do just that. So to look at genetics and to look at prenatal history, to look at triggering events that have happened, whether they're medical or mental, emotional, spiritual. And then what are the modifiers of all of those things? And modifiers are modifiable lifestyle factors. So nutrition, movement, sleep, stress management, and connectivity. So relationships. So it's really looking at the physical, the mental, the emotional, the spiritual pieces of a person and putting together their story of their life to fit into how they're showing up in your space with you. And that's so different from Western medicine, right? So that's really functional medicine. And then integrative medicine, I think of as a conglomeration of all of the different approaches that as a provider you're familiar with. So lifestyle medicine, so looking really at how people live their lives. And then adding in complementary approaches like acupuncture or meditation or qigong or chiropractic, whatever these different sort of complementary approaches are that you utilize within your practice, that's integrative medicine. So they're a little bit different, I think, but we lump them together a lot because functional medicine doctors use a lot of different complementary approaches, which sort of creates this integrative space.
Right.
Does that
This makes sense.
make sense?
Hearing you describe that, it makes me wonder if maybe the functional and integrative medicine approach is kind of a reaction to what I think in Western medicine has become an increasingly specialized approach to medicine, right? We have cardiologists. We have, and thank heaven, right? These systems are really, really complicated. It's good to have somebody dedicating their entire career to specific systems.
Yeah, we need that.
We do. But it also you run the risk of breaking human beings down into these just constituent parts and then saying, well, you have stomach problems. It's because something is wrong in your stomach. And so we're just going to treat the stomach symptoms. And if I'm hearing you right, Amy, we're missing what could be contributing to this particular symptom, which could be this broader systemic, multifactorial cause, right?
Absolutely. Yep. I think that's spot on. I mean, our system is so focused on systems, right? Like everything is just broken into a heart system, a stomach system, a brain system, a musculoskeletal system. And that's ingrained in our culture of medicine, right? I mean, that's how we were taught in medical school about humans, is breaking them into these little parts. And that translates through the whole system. And we really lose touch with what is driving how a human shows up, and really it all has to do with genetics are part of it, but how are they raised? What were their parents like? What was their home like? What were their adverse childhood experiences? We could talk about ACEs for hours.
Right.
And then what foods, what toxins, what other stressors were they exposed to throughout the course of their childhood and their life? And then you're presented with this person that shows up with all of these complex issues. And just doing tests and throwing medicine is not working, right? So we have to start thinking about what drives our behavior, what drives our physical, mental, emotional, spiritual selves, what really drives all of that, and how can we help people address it and move them along the continuum of change to get better.
Yeah, I love how you put that. I think it's a beautiful approach of going for the root cause, the preventative approach, but looking at the whole person, like not ignoring the psychological, emotional factors, the toxins, the other organ systems. And it seems to me, and correct me if I'm wrong, that primary care has adopted this maybe first in a much needed way, because we've especially been missing that integrative, functional quarterback of one's health. And it's getting adopted by other specialties too, like much needed, of course, in mental health, we've been way too focused on treating symptoms rather than root cause or even preventative. But is that what you've noticed? Like it's entered primary care first, perhaps, and then moving into the other areas?
Yeah, I mean, I would say in the 5 years that I've been completing my training and meeting people in the field, I definitely feel like internists, cardiologists for sure, because there's such a lifestyle component to cardiology and metabolic disease. Internists, cardiologists, primary care docs, and OBGYNs seem to be a big part of, because OBGYNs, I mean, they are essentially taking
Women's
care
health,
of women from
yeah.
a primary care perspective, right? So it was a lot of those people that I initially came into contact with, but now we're seeing functional medicine show up in GI docs and musculoskeletal docs and neurologists, of course. And so I think it's really expanding throughout our entire medical system as we all become sort of disenfranchised with big medicine and systems-based medicine and symptomatology-based medicine, because like all you have to do is go to the airport. Like people are not getting better, right? We spend more money on healthcare than any country in the world, and you go to the airport and it's just like we are the most unhealthy, dysfunctional, poorly socialized over-consumers on the planet, and it's not working the way we're doing it.
Yeah, so it's about time this comes into medicine. What do you notice at the airport? I'm just curious.
Oh my gosh.
The sheer number of people.
The sheer number of people that are overweight or obese is just breaks my heart. And teenagers, young kids, old people, like entire family systems that are overweight and obese. And, people don't really look all that happy, right? They're standing in line to pick up their, 1 foot Subway sandwich with the pastrami and the salami and all of the crap on it and their Coke. And it's just so dysfunctional, and everybody's just sitting there on their phone, and families aren't even talking to each other. And it's just, I don't know. I mean, the airport is just always a place for me where I'm just like, oh my gosh, it's not working. It's not working out,
Yeah, those observations always make me think of like human health from an evolutionary perspective. I think our society, for all the great things about a modern 2021 society, I don't think the human organism evolved to live and thrive in the type of society we've created, where we're sedentary, where we have hyper palatable foods that are filled with sugar, and where we eat as much as we do, where our brains are. Reid and I have talked about this on the podcast before, but like the dopamine diet that we're on is probably unsustainable for most of our minds.
Oh yeah.
No.
I see it in my kids. If they've, if I've let my vigilance slack and they've been on screens for a long time, anything else is boring. They even get bored of the screens themselves, and then it's hard for them to feel pleasure at all in things that, before the advent of screens would have brought plenty of pleasure, like just playing in the dirt as a 6-year-old.
Yeah.
Yeah. What's that movie? Was it WALL-E?
Yes.
The movie where it just had this striking scene of humans, sedentary humans plugged into these chairs on a spaceship, drinking soda or liquid nutrition all day.
Well, and like one of them gets dumped out of the chair and they can't move. They can't get back because their muscles have atrophied and their bone density is
Use
low.
it or lose it.
Yeah.
We talk about WALL-E at our house all the time, and have since they started watching it. Like, you want to turn out to look like a WALL-E person, like keep eating like that and keep sitting in front of a screen, and keep throwing trash out into the street. We use that WALL-E all the time at our house.
Yeah.
That's exactly that's where we're headed if we don't get a grasp on this. And that doesn't even touch the concept of what's happening with our behavioral health and substance use diagnoses, right? I mean, record numbers of overdose fatalities, record numbers of suicide, record numbers of hospital admissions. I mean, yeah.
Yeah, and like our friend and mentor who we admire says, Gabor Mate, it's not about in addiction, it's not about the behavior, it's about what's underneath it, not why the addiction, why the pain.
Yep.
And there's lots of things causing pain for sure. And I think when we have conversations like this, we want to make sure people know, like, don't judge yourselves too harshly. We're certainly not judging you for having any kind of self-defeating habit. I have plenty of them. We live in, as I was saying before, in a society that makes it difficult for a person to be healthy. I mean, I think of my own relationship to food, for example. You know, we can talk about nutrition medicine here in a second, or dietary interventions for mental health issues, but I'm pretty public and like to joke around about my relationship with food. Has not been a healthy one growing up.
Yeah.
Emotional eating for sure. If you were upset in my household, it was, here's something sweet, or here's a loaf of bread to consume in one sitting. Like,
yeah.
Yes.
And these foods are, they don't come from nature, right? They're made in a laboratory to trigger brain reactions that you just wouldn't have encountered on the savannah or in the jungle or whatever.
Exactly.
So have some compassion for yourself, folks, as you're trying really, really hard to be healthy. The cards in some ways are stacked against you.
The cards are stacked against us from the top down, right? I mean, how much money is dumped into our food engine? I mean, a food monster is what I call it. I mean, you just walk into a store and the odds are stacked against you, right? And there's sort of this culture of eating healthy is really expensive. If you want to feed your family, here are the things to buy. They're not expensive. They'll fill you up. Your family will be fed, which, I mean, we could have a whole show on that. I mean, there's so much data about food and the food industry and this whole sort of idea that you can't afford to eat healthy food. The odds really are stacked against us. And when we show up in our doctor's office and our hemoglobin A1C is 11.3, most doctors have time to start you on insulin and metformin, and that's about it. And as you're walking out the door, they say, well, you might want to consider decreasing your sugar intake, right? So that's just not enough. There's not enough time to educate people, and there's not enough time to help people create the behavioral change and become disconnected from their relationships with food. Like, we just don't have time built into the system for that.
To me, that's the heavier lift. It's not just education. Like, most people probably could figure out that their diet is causing their type 2 diabetes, and if they changed it, it might get better. So education maybe, but it's the support. And how do you help somebody change a habit like that when, as you say, from the top down, the cards are stacked against them? And there's lots of psychological variables at play, keeping them turning back to this type of lifestyle and that type of diet.
Well, go ahead.
No, please.
I think that's where functional medicine is so critical. I mean, James Maskell wrote a book called The Evolution of Medicine, really calling providers to the practice of functional medicine, and that's who inspired me to become certified in functional medicine. And he really is a leader, along with some functional medicine practitioners, leading the charge to create community medicine. And community medicine, group medical visits. I mean, we could do a whole show on that too, right? But group medical visits, community medicine, really, that is going to be how we educate people and how we create this support system to surround people as they move through this continuum of change, using health coaches and providing physicians with the training to become coaches themselves, in a sense, and delivering it in a model where we can see 15 people in an hour and a half instead of just 2 people in an hour and a half. You know, it's a numbers game. Financially, we can't support sitting in rooms with people and doing this. We, you know, one-on-one.
Right.
We have to create this group model where we can educate people, where we can connect people together to create accountability, and where we can provide coaching and support. That's really, functional medicine is a leader in that space for sure. And something that, you know, Reid and I are talking about all the time. How do we bring this to Novamind? How do we bring this to our organization in a meaningful way that is sustainable financially, but is able to, that we're able to scale it in a way that we can actually reach a lot of people and not just a few people that can afford it.
Do you feel like it's the case that it's not only more accessible, affordable, but in some ways the group model affords a more powerful approach because of the community?
Absolutely.
Yeah.
I mean, there's data on this, right? Jeff Geller, Dr. Geller has data on the empowerment model and the group medical visit model. Decreases anxiety, decreases depression, decreases isolation and loneliness, improves outcomes in diabetes. It's the way, it's the future.
Yeah,
Sure.
we see it and talk about it a lot in psychedelic medicine. And of course, for years in mental health, we've been fans of the power of the group. But it's really neat to hear it applied in this way, or to see it coming in like group medical visits. In fact, that functional medicine event for clinicians that you organized at our Murray office a couple months ago, I had met a primary care doc up there who I referred a family member to, because it's so hard to get good care, someone who will listen and spend the time. And so this physician, she spent a lot of time, and in fact had like 3-day food diary beforehand and all this information. And you know, I gotta say, it was game changing for this family member who went there and felt heard and seen. And then there was a whole plan of what's going to happen next, and there was a group to support, like, how do you actually do an elimination diet to get to this next step? It's not easy, we know. So there's this group starting next month that you can join in and share ideas and tips and education. So yeah, I thought it was really neat.
Yeah, that is the group medical visit model at its best. I mean, it's really powerful.
Yeah. I mean, so as I hear you two talk about this, it seems, powerful. It seems like a puzzle for the healthcare organizations as they stand to try to make affordable, like profitable enough that we can keep the lights on, and affordable enough for the patients that they can pay for it or get insurance payers to pay for it. And you'd think insurances would want to pay for something like this, especially if it decreases healthcare utilization for people. Right?
They are paying for it. Like, I mean, Dean Ornish is a great example, cardiologist. He was the first physician to create a group medical visit model directed specifically at patients with cardiovascular diagnoses, and Medicare now pays for that.
Oh, cool.
So that's a great example of, and that's based in functional medicine. I mean, it's nutrition, sleep, exercise, connectivity. And yeah, I mean, Medicare now pays for the whole Ornish program as an organization. You can bring it in, and Medicare will reimburse for it. And other insurance companies are following suit. I mean, we started some group medical visits at a publicly funded program here in Salt Lake. And that was, you can bill a 99213 or 99214, which is just a term for how we get reimbursed as docs. And we, could treat 8 or 10 people within an hour and provide education and support and medication management. And it was reimbursed by Medicaid. So there's
some precedent then.
There's precedent. It's been going on for years, actually. I think it's just taking shape now.
Yeah, it takes those pioneers like Ornish, and it takes people who really share that vision. I mean, Ornish is known more for his his diet now, but he did some amazing things in terms of that whole lifestyle approach. But it probably took a long time to get insurance on board. And I think it just screams at me the need to challenge the status quo, or like figure this out, because the stakes are high. It's important. And it sounds like that's what we're doing or embarking on with your substance use disorder program, right?
Yeah, substance use and integrated behavioral health, I think. Yeah, trying to figure out how do we deliver this to people within the context of insurance in an outpatient setting to provide a much needed service that's really not out there right now.
So why don't we pivot a little bit and describe to us the ideal functional medicine approach. Like if you have a patient come in and they say, I'm super depressed, and you had all the resources in the world and all the time in the world, how might you assess and treat that patient? Somebody who comes and says, I'm super depressed, can't get out of bed, and they severe major depressive disorder.
Yeah, I mean, I start out collecting a lot of history, so a 3 or a 7-day diet and lifestyle journal to figure out what they're eating, how much they're moving, how much they're sleeping, what their social connectivity is like, how do they manage their stress. We go through a functional medicine timeline, so the things that I was talking about previously, genetics, prenatal, birth history, and then looking at all of the triggers and sort of events throughout their life. And then, bringing in all of that lifestyle information to sort of inform me about the person as a whole. And then I do pretty large laboratory workup, including just basic labs, metabolic panels, inflammatory markers, hormones, thyroid.
You do micronutrient?
If somebody's really sick, I'll do, there's a lab that does a really large workup, a nutritional workup that includes micronutrients, fatty acids, all of that. It's really expensive. So I don't usually come right out of the gate with that. It's about a $600 test.
Oh, wow.
There are only a couple of labs in the country that do it. For really sick people, I will do that. But for just kind of your basic person coming in, I'll do a pretty extensive functional lab workup. If they can afford it, I'll always do hypothalamic pituitary axis testing to look at their cortisol, because that's so informative for so many things. And then I'll pull all of that information together, and we'll meet. Usually I have a family member come as well, depending on how sick the person is, just to provide some context and sort of help them provide me with additional information. And we'll sort of go through everything and come up with a game plan. And I really try to meet people where they are. So I'll ask them, where do you want to start? What makes the most sense for you? Do you want to start with getting some more movement? Do you want to start with taking a deep dive into your nutrition? What can you do in the context of your life to start this process? Because I can create a big plan and, come out with all these different ideas, but if it's overwhelming and they feel like they can't execute it, then normally they just don't do anything, right?
Yep.
If we give people too much, they just don't do anything. So I'll summarize for them the different pieces that I think we need to implement, and then I'll really let them sort of direct their care and figure out what the next step is. And just kind of go from there, see them every month and keep working on it, creating SMART goals and trying to help follow up with them. I do a lot of just texting and follow up with my patients. And use nutraceuticals based on their labs, and really just kind of dive in. It's a really fun but difficult process because there's so much psychology involved.
Oh yeah.
So, and I'm not a psychologist. So there's a lot of motivational interviewing and a lot of, just it's a process for sure.
Well, that's what I keep thinking. Like, and I've had clients go and get these full workups by functional medicine docs, and they do get overwhelmed. Like, okay, I've got all these biomarkers that are weird, and I now have to change my diet, and I know I got to exercise, and I know I got to sleep more, and I know I have to get off my screens, and I know I have to connect with people, and then it's like their treatment makes them depressed.
Yes.
Because the treatment plan seems insurmountable.
Overwhelming.
Yeah. So I like what you said. You meet them where they are, and you get buy-in and collaboration. Where do you want to start? And let's just pick one little lever to pull.
Yeah.
And where can we just, begin the journey?
Yeah.
Yeah, it's like we ask people after, like in the psychedelic integration process, like what's one thing you can do in the next 24 to 48 hours to support your integration, your healing journey. And I like to do that in the lifestyle medicine realm too. Is like, what, not even waiting until tomorrow. What's one thing you're going to do today? And it doesn't matter if it's 5 minutes of movement or breathing. Like
it could be drink a glass of water first thing in the morning, right? I mean, it could be as simple as that, trying to start new patterns.
Yeah, it's really interesting. If I can get people to buy in, if someone is not too sick, if I can get people to just buy into starting their day off with a smoothie, like I will often start there because people don't often eat in the morning, or if they do eat, they have a bunch of coffee and then bacon and toast or something, like something really not nutritionally dense, nutritionally healthy. So if I can get them to have a smoothie in the morning with a lot of nutrients, omega fatty acids, a lot of fiber, and get them to go walk for 5 minutes, it is crazy how much better they feel when I see them in a month. Like just doing that. It's so wild how much better people feel just moving 5 minutes every day, like you were saying. And often that is enough to just kind of start
tip the scales a bit.
To tip the scales just a little bit, and my friend Catherine Van Tassel and I, she's a PA LCSW nutritionist. We ran 2 12-week plant-based curriculums out of my office, and we had about 10 people in each group, and we started everyone with the smoothie thing. Just change one thing, just do a smoothie. And it was just like magic. Like they just felt so much better starting their day. Their blood sugars were stabilized for a few hours. They had a little bit more energy, a little more spark, and it just sort of set everything in motion. And that's just, it's only one thing,
I think people would, if they don't know, they would be surprised how much blood sugar fluctuation feels like depression.
Oh, yes. Yep.
Like a blood sugar crash, especially if you have major depressive disorder, you're prone to depressed moods, and your nervous system isn't supported by an even blood sugar, and you eat a bunch of carbs and then it crashes. That can be enough to send a person into a major depressive episode or keep them there, I think.
Yeah, and it has a lot to do with cortisol and insulin resistance and all of that. I mean, we could talk about that forever. And inflammation.
Sure.
Just getting people to eat a little bit better and move a little bit better is so helpful for so many things.
So Amy, you say a smoothie. I imagine the smoothie is prescriptive. It's not like a Jamba Juice that has 1,000 calories of fructose in it or whatever.
Yeah, that's right. Yeah, like I have a whole smoothie handout.
Recipe thing.
Yeah.
Okay.
To incorporate fiber and fatty acids and all of that. Yeah. And it's easy. I mean, it's a pretty easy thing to do. Most people have a blender and most people can do it,
My oldest son flew home for the holidays from a farm he's been working on in Hawaii, and he's vegan and has really found a love for cooking. And so over this break, there have been a lot of smoothies made. A lot of these, he calls them Buddha bowls.
Yeah.
Or just like, quinoa, lots of grains, all these veggies. And it's amazing to see my other kids take a liking to tofu that they didn't know they could handle, or try vegetables they've never even heard of, and really enjoy the food, but really enjoy the process too of creating it or connecting with like real whole foods instead of this stuff that in a plastic wrap, we don't know what it is or where it came from, but or what's
in it.
Sure.
Yeah, that brings up, the really interesting concept of culinary medicine and community cooking as medicine. There just is this sort of collaboration and joy and community building that comes from making food with people. During my fellowship, I did some work at this publicly funded program, and I did a 12-week curriculum again with guys in residential treatment. And the best days, the things they loved the most was when I would bring in something to make food together. So we made smoothies together. We did avocado toast. We did peanut butter and fruit toast. I mean, those things are so simple, but there was just this joy and this sort of meshing of people from making food and consuming it together. And there's a lot of evidence about culinary medicine actually as a great way to educate people and to create community. So just like you were saying, like it takes 3 months to change your palate. So I always tell people as they're trying new foods and trying, new nutritional patterns, like if you don't like something, keep trying it, because it takes 3 months for the taste buds to sort of
turn over
and for your palate to become adjusted to something new. And if you just tell people that, it's like when you start a new medication, right? Like if you don't like how it makes you feel, just hang on for a second because it's probably going to get better. Don't give up. And so if we tell people, don't give up on these new foods, like hang in there, it's going to get better. And if you just tell them that, a lot of the times they'll hang in there and they'll be like, oh my God, I like garbanzo beans.
Yeah.
I never thought I would like a garbanzo bean, and people end up liking it. And it's really cool to see that sort of shift,
Yeah. We talk a lot about, on this podcast, Ram Dass comes up a lot, and Richard Alpert, Harvard professor in the 60s, psychedelic researcher, drops out, goes to India, finds a guru named Neem Karoli Baba or Maharaji, who taught him that, love everyone and feed them, because food is love and service is love. And that's what, it's something that's been really striking to me, showing up in the spiritual realms and the psychedelic realms as well, is that they just use food in that loving way. Or even Michael Pollan, some people forget that he's started out more as a food writer. And they know him now as a psychedelic writer, but he had that mantra from one of his books in defense of food that I really like, called Eat Real Food, Mostly Plants, Not Too Much.
Yeah.
So the palate changing, 3 months. I hadn't heard that. And is that to some extent, is that a factor of like the gut microbiome too? Because I've heard that, the condition of the gut microbiome can affect not only your mood and energy level, but it can affect the kinds of foods you crave. Yeah. And I mean, I've heard, I should probably Google this thoroughly to see if this actually happened, but I heard that through a fecal transplant, like some people, through some aggressive microbiome treatment, like with a fecal transplant, had some pretty significant psychological changes. Like get somebody else's poop in there and you change who you are.
Yeah, the microbiome is so important for our brain. I mean, the gut and the brain are intimately connected in ways that are just, I mean, it's amazing. It's like magical how connected they are, and more evidence is growing every day. Like if you look at articles published on the gut-brain axis since like 1999 or whatever, I mean, it's just like the number of articles, But fecal transplants, and then the other thing that fecal transplants can affect mood for sure. And then people who undergo gastric bypass, there can be really significant shifts in the microbiome. Actually, for better and for worse, people who have had gastric bypass are at increased risk of developing substance use disorder, specifically alcohol use disorder. And we think that that is because of some significant shifts in the microbiome and the vagal innervation, and how that affects the gut-brain interaction. And so, yeah, there's a lot of interesting discussion around the gut microbiome and mood and substance use disorder as well.
Well, and a lot of folks will just take a probiotic and like, okay, I got my gut biome in check. That's going to be enough. But, there's so many different species of bacteria, and who knows if bombing your gut with one particular species from this particular probiotic is even good for it. And then there's a conversation around prebiotic fibers, right? As opposed to probiotics. If you can feed the bacteria in your gut with the right starches, the right foods, then maybe that's better, or maybe you do it in combination. It can get kind of overwhelming, especially for personalities that like to optimize. I mean, we've been talking about the depressed folks who just need that one tiny lever to get started. And then you have the sort of human optimization folks who want to make sure they got everything dialed in. They're doing their blood work twice a week. They've got they got a glucose monitor, even though they're not diabetic, because they want to check their blood sugar all the time. And, I think you can probably get too deep into the weeds about this stuff, and maybe extend further than the science. Extend further than the science, I guess, exists to support what you're doing. Do you run into that with functional medicine, where you have people who are maybe making some claims that aren't substantiated under the guise of like, this is integrated or functional?
There's that, but there's also the risk for a subset of individuals of getting obsessed. Like we've talked about it in our eating disorder discussions on here.
Orthorexia.
Not an official diagnosis, but a struggle I've seen countless times in countless individuals, and I don't think everyone's at risk for this, but there are some temperament traits and predictors and lifestyle events that put you at even greater risk. But orthorexia being an unhealthy obsession with clean eating, where some people can't not weigh their food before consuming it, or can't restrict the rules to allow enough of a variety of foods, or it just consumes so many hours of their day thinking about it or worrying about the impurities and things like that.
Yeah. Sometimes I worry that some of the food gurus out there, like the diet gurus that have followings, are just highly functional orthorexics that have created religions around their particular diet.
There was a study actually where they looked at the top 20 or so food blogs, and then in whatever way they can, I don't remember the methodology, but they were able to tease out that a significantly high percentage, a majority, did have some kind of dysfunctional relationship with food that was really weighing on them in their lives.
Yeah, that makes sense to me.
I mean, it's a pendulum, though. I remember when I went vegan first, or at least vegetarian at age 18, 19, really experimenting, I did go deep and get immersed in it, or maybe a little unbalanced with it, but have had to find my own kind of flexible approach to moving through these things. Like I personally like to still be able to have a bite of cake and not have it feel wrecked for days. Like I like to have a resilience too, to be able to go through life and enjoy variety and experiences,
Yeah, have some metabolic flexibility too, right?
Yeah.
So I think if you're too strict, and you guys can correct me on this, but if you're too strict, sometimes you lose that flexibility. You have that piece of cake, and it does totally wreck you because your system's not ready for it.
'Cause we see it in the eating disorder treatment center setting of refeeding. That's hard work because you've often been off of a lot of different types of foods, like dairy as an example. I know it's debatable on whether or not dairy is useful or needed, and there's all sorts of kinds of dairy. But if someone is severely underweight to the point of their life's at risk, and we need to refeed in a medically supervised way, and if that's part of it at first, if you haven't had dairy for months, but you're having these shakes as part of a refeeding process, they can be really uncomfortable on the gut as you get reaccustomed. But then that gets better. Same with gluten. Some people like restrict their foods so much that there's not much left that they can eat. And there is something to be said about the other side of this coin, the flexibility. Although I realize these are hot topics, and they're important issues on all sides of the debate, depending on what you're treating. Like if we're treating the Wally situation, or like an OCD anorexia or orthorexia situation.
Yeah, I think that's what's really nice about functional integrative medicine. I mean, at its core, it's personal medicine, it's human medicine. Yeah. And so just, doing a lot of work, talking with the patient about what can they do, what is making them feel better, I use a medical symptoms questionnaire. Every time I see really sick patients, I have them fill it out, and it's about 50 different points for every system. And it's really important to use some sort of data to sort of track how people are feeling, because people will say, oh, I don't feel any better, like nothing's working. But then you'll look at the medical symptoms questionnaire, and like all of their gut symptoms have resolved, and you're like, oh, your gut is so much better with these changes that you've made. You're not feeling bloated and only having a bowel movement once a week anymore. Like you're making positive change here, so what can we do next? And I really like that about, the training I've had in functional medicine, is just taking a really personalized approach. Yeah. There's no one size fits all. I start with a basic construct, sure, because you got to start somewhere. Standard approach, yeah. But then there are just so many different pathways that you can go down. I mean, you can do comprehensive GI analysis. You can do a NutriVal, looking at micronutrients and fatty acids, and, the Krebs cycle and all of that. You can do,
autoimmune testing,
hormone
you
deep
can
dives,
do hormone deep dives. You can look at food sensitivities, which, I mean, I don't really look at food sensitivities very often for a myriad of different reasons, but I mean, there's so many things that we can do to help people as they are trying to sort of sort out what's going on with them,
Yeah.
There's another term, we were talking about nomenclature at the beginning, functional, integrative. I've been hearing a lot lifestyle medicine. Can you comment on the differences there, or what that approach specifically would be like?
So the American College of Lifestyle Medicine has a certification program for providers, and it is very evidence-based. It is all evidence-based, looking at nutrition, so healthy diet, mostly plants, movement and exercise, sleep, stress management, healthy relationships, and reducing risky substances. And, it's just I don't want to say it's just another way of looking at the same thing, because it's not, because the ACLM is great and they have their own very specific platform and training. I'm going to complete that training next year. But it's very prescriptive. So it provides a very clear construct for taking people down these different lifestyle changes in these 6 different pillars. But I mean, functional medicine has a huge lifestyle component too, right? Modifiable lifestyle factors in functional medicine are very similar to the pillars in lifestyle medicine. Right. So there's a lot of overlap. It's just that I think the delivery and the training is a little bit different, but there's so much overlap. Yeah. It's very similar in its delivery of information to the consumer.
Right.
Does that,
Yeah.
if that makes sense?
Well, and you were careful to point out that it was evidence-based, right? And I think that's probably a reaction to what might be an implicit bias for some people when they think about lifestyle medicine or functional medicine. Sometimes they think about hucksters. They think about people, buy my supplement that's going to balance your hormones. And maybe it's a supplement, so it's not regulated by the FDA. And a nutraceutical is, I guess, technically something that is not technically regulated by a body like the FDA or the government. And so people who are thoughtful might be concerned if they go to a functional or lifestyle medicine doctor that they're not getting evidence-based treatment. But you have these organizations, like the one you just mentioned, these regulating bodies that are trying to ensure that what you're getting is still supported by this scientific method that we love so much, right?
Absolutely. I mean, I have most of my functional medicine training was reviewing the literature. Mm-hmm. So it might not be the same literature that I looked at when I was a family medicine resident, for example. Yeah. But it's literature nonetheless.
Sure.
And all of my, faculty in my functional medicine training, I mean, I would send any of my family members to them in a heartbeat and know that they're getting good evidence-based medicine. It just looks a little bit different than maybe it looks like going to a more conventional physician. But these are all MDs. They've all been trained in the system. They're all practicing a lot of them practicing in Western, Western medicine institutions. But they're just bringing in sort of this broader focus. And honestly, I think a lot of the reason people get so up in arms about functional medicine is because they're not peddling pharmaceuticals. And, that tends to piss people off. I mean, I'm sorry, to be controversial, but
how dare you?
But it's true. I mean, if we're not peddling pharmaceuticals and expensive surgeries and expensive testing that brings, money to CEOs at hospitals and insurance companies, well, then you must be a total quack. Do you know what I mean?
Yeah.
But I for sure am not a quack. I am very much evidence-based, but I don't do things that some of my functional medicine colleagues might do. There's a spectrum for everything. There are functional medicine doctors who don't believe in vaccination. That's not me. That's not anybody who trained me. But I think there's a spectrum in everything, right?
Yeah.
In conventional medicine as well.
We're in this integrative phase. I heard it described chronologically by a friend and mentor, Dr. Scott Shannon, and his business partner, Mary Rondeau. They run the Wholeness Clinic in Colorado. But they came out to teach our group on some integrative medicine concepts, and they described the history as, we used to call it complementary and alternative, because this is stuff on the outskirts, like acupuncture. That's weird. We're going to send you over there to do it, and it's not part of mainstream medicine yet. But now we're in this era, decades later, where it's becoming integrated, or it's integrative as part of day-to-day healthcare. But we're moving towards this place where we want to be, of holistic medicine, like treating the whole person, root cause, preventive, and holistic. And so I think that I like that way of looking at the big picture and where we're at, acknowledging that we've come a long way, but there's a lot of work to do.
We have come a long way. I went to the VA for an appointment for some tennis elbow, and he gave me acupuncture.
Yeah, I was going to say the VA is amazing. They're doing tons of acupuncture at the VA.
Yeah.
Yeah.
I remember the doc. He's like, "Would you be down for some acupuncture?" He was kind of treading lightly, and I'm like, "Yeah, sure. If you think it'll help."
Yeah.
So I got physical therapy. I got acupuncture. Before we do surgery on you, because they don't want to rush into surgery, we're going to do all this other stuff.
Yeah, it's important to point out too that just because we don't understand how it works doesn't mean it's not evidence-based.
Right.
You know, and doesn't mean it might not be evidence-based. Sometimes just the studies haven't been done.
Yeah, and I mean, with a lot of complementary approaches, acupuncture just specifically, because I've done a lot of work with ear acupuncture, so I've taken a lot of deep dives into acupuncture, but acupuncture is hard to study. I mean, it's sort of like I'm doing all of this reading on psychedelic medicine now, right? Like to do a randomized control trial for psychedelic is hard because what do you use as the placebo?
Right.
Like what's that conundrum all about?
Yeah.
Well, acupuncture is similar in that it's really hard to do a placebo acupuncture, right? Like, so do you use different points, sham points? Do you use different types of needles? Do you, you know, it's really hard to do a randomized control trial for acupuncture, but they have been done and there is evidence that it works. And what's even better is there's evidence that there aren't a lot of negative side effects. So it's like if we can pull things into our toolbox that are helpful, that might not have giant randomized control trial evidence behind them, what is the pushback there? Why is it so hard to convince people to use something just because there's not a large randomized control trial? Like, I just think we've gone so far down that pathway with evidence-based medicine that we do forget that things work. There's a lot of different ways that things can work, you know, and acupuncture is one of the most amazing tools in my toolbox.
Yeah.
Like, I'm not an acupuncturist, but I send people to an acupuncturist. Most of my patients end up at acupuncture, and I've had better results with acupuncture than I've had with just about anything else.
Wow.
Do you send people to auricular acupuncture in particular mostly, or all kinds?
No. So I'll do acupuncture, ear acupuncture for people
administer
in the
that,
office as sort of like a teaser, like a introduction, and then refer them to one of, you know, about 3 acupuncturists that I use in the community if they're down for it. But it's amazing for cortisol dysfunction. It's amazing for issues related to reproductive health. It's incredible for addiction, depression, anxiety. It's
auricular
the jam.
or in general? I'm curious what you use the auricular or ear acupuncture for, in particular, the most common conditions.
I use ear acupuncture. I was trained in the NADA protocol, so National Acupuncture Detoxification Association, which historically was used for helping decrease withdrawal and cravings for people coming off of methadone. So it historically has been used in that context, but it's used in a broader context in situations of trauma or significant stress. So the protocol was used after 9/11. It was used after Hurricane Katrina. It's used now for first responders. It's used now for frontline healthcare workers. So it decreases anxiety, decreases stress, improves sleep, decreases pain. I mean, I could tell you a million stories of ear acupuncture, but it's a great way to introduce people to acupuncture too, like just sort of to ease them into the idea.
Maybe we should have you bring it to our next frontline healthcare worker ketamine group.
Yeah, that'd be interesting.
Oh, we should. I'm going to do frontline
combination.
health. I'm going to do CAP.
You're doing our next frontline CAP group
I'm
up
doing
in
it.
the
I
Murray
should-
Clinic, right?
Yeah.
Cool.
We should do it in the integration, in the groups. At the end, we should have like 20 minutes of it. It's amazing.
That'd be interesting. I had
It's amazing.
Now I'm having now flashbacks. As a child, I had chronic ear infections, and my mom took me to a Chinese medicine doctor, and I remember needles in my ear. I also remember acupressure. So they had little
Beads.
like little beads, and they would with Band-Aids or whatever, taping my ear. I remember that hurting
For
way
a couple
more.
days, you'd push the spots
Yeah.
in the days that follow. Yeah, interesting
Also,
approach.
trigger points on the bottom of the feet. I was reminding my mom of this, and she had forgotten that she was way into this, apparently. But
Yeah,
I was
reflexology.
Reflexology.
Yeah.
I was sleeping on magnetic mattresses. I was taking bee pollen and propolis. My mom was doing muscle testing.
That's awesome.
Plague tonic, which she buried in the backyard, and like
Whoa.
You come from
origin
a
story.
long line of integrated medicine. Like it's in you.
I've benefited greatly. From
Yeah.
it, for sure.
Yeah, acupuncture is, it's amazing.
Well, I like how we're talking about how there are lots of different kinds of evidence, right? The RCT is sort of the gold standard of the scientific method applied to medicine, but it's not the only way to pull evidence out of data to support your practice. As we draw to a close for today's episode, we've covered a lot of ground. I'm going to ask our listeners and our audience if there's anything that we've talked about today that's piqued your interest and you want us to do a deep dive in, please let us know. Email us, comment on whatever platform you're using to listen or watch this, and let us know what you'd like us to talk about. Because like Amy said a couple of times, we could do entire episodes on a lot of these topics. So anything else, Amy, that you'd like to talk about real briefly with respect to functional medicine, especially as it applies to psychiatry, to the treatment of mental health problems, or any teasers maybe for future episodes?
Yeah, I mean, I just think that the opportunity here with us at Novamind is it's huge because we have a way to create a discussion about how do we sort of move forward the practice of integrative mental health, or whatever we're going to call it. How do we bring in the lifestyle piece and the functional piece to the treatment of complex behavioral health diagnoses? Because medicine is not doing it, therapy is not doing it. What else do we need to think about? And so thinking about the gut-brain axis and how do we change people's nutrition to support a healthy gut, to support a healthy brain? How do we use nutrition to reduce inflammation? Because if your body's inflamed, your brain is inflamed. Inflammation has been shown to play a huge role in all behavioral health diagnoses. Just how do we leverage some of these, I'll put it in quotation marks, simple things like nutrition, movement, sleep, connectivity, stress management? How do we leverage those things to help people heal and really heal, not just like put a Band-Aid on a symptom, but actually begin to heal themselves physically, emotionally, mentally, spiritually? I think we're in a unique position to implement these things and to track outcomes and to then bring in the psychedelic medicine as well on top of that, and to be, leaders in the space of psychedelic medicine and substance use disorder, for example. We were talking about that this morning. How do we implement that? I think there are just so many opportunities to look at all of the different ways. Hormones, huge. Like, I would love to come back and talk about hormones and mental health. I think there are just so many things to talk about and so many ways that we can approach people that have really complex diagnoses that are just devastating, right?
Let's do it. It's a new era in mental health, and we're so glad you're here with us because it's an exciting time to be doing this. And such an important component that's been missing for so long is bringing in that holistic mind-body medicine approach to our healing and growth.
Well, you mentioned, the psychedelic piece and something that sets us apart at Novamind, but, the name of the podcast is Psychedelic Therapy Frontiers. We're really excited about what psychedelic-assisted psychotherapy and psychedelic medicine can do for these, what have been intractable conditions, or just human suffering generally. And I think psychedelic medicine and functional medicine, holistic medicine fit perfectly together, right?
I think so too.
But we don't want to just focus too much on one or the other. I think we need to approach the system from this broader perspective, and I'm excited for what the future holds for us here at Novamind, but for the whole endeavor. Generally.
Yeah, this is really integration we're talking about. Like, take the medicine out of it. I think a big part of the healing that happens when people go off to psychedelic ceremonies or retreats, like ayahuasca, for example, a big part of it comes from the psychospiritual and physical preparation and the integration you do of bringing new lifestyle practices to support that. And something that I think we've neglected somewhat in the traditional treatment realm for too long, but I believe that psychedelics are helping bring that back in parallel with this functional medicine, integrative medicine renaissance that's happening too. I think it's a perfect storm that's leading to some good change up ahead in our healthcare system.
Yeah, what you just said made me think of it's the difference between passive healing and active healing, right? The traditional Western approach to medicine is take 2 of these and call me in the morning. Like, I come to the doctor, I've got a problem, here are my symptoms, give me something that will take those symptoms away. And all I got to do is ingest it or inject it or whatever it is. But like with psychedelic medicine, the intent that you bring and the deliberate focus that you bring to the process is more than half the battle, right? And so I'm hearing what you're saying, Reid, like, I don't know, that seems to be a huge component of it, and a huge part of what makes it helpful is how deliberate the individual has to be in order for the change to take place.
Yeah, and like wellness, like that's just making me think of wellness, like, because there's a lot of, like, wellness medicine is also like kind of a buzzword, I think, right now. Yeah. What is wellness? Wellness is the active pursuit of being well across multiple dimensions, right? So, like,
not just the absence of symptoms.
It's just not the absence of being ill or not having symptoms. It is the person actively pursuing their own wellness. And we are the guides. Like, we can't do it for them. Like, us giving them a medication or us giving them a prescription for 30 minutes of, moderate cardiovascular exercise every day. Like, that is not it. We are like the guides for them on their journey to healing and wellness. And it is completely active. There is nothing passive about it. It is their journey,
We're just trip-sitting their wellness journeys.
There you go.
There's so much overlap between these two psychedelic functional spaces. It's crazy.
It's true.
Yeah.
Well, Amy, thank you for joining us. You're going to see a lot
more
more of Dr. De La Garza in the future.
Yeah, thank you.
Awesome. Thanks folks. Thank you, dear listener, for listening. It means a lot to me. Psychedelic Therapy Frontiers is brought to you by Novamind, a mental health company that specializes in psychedelic medicine and research. You can learn more about Novamind's mission to increase access to legal, safe, and evidence-based psychedelic medicine at novamind.ca. If you like what you heard, please subscribe to the podcast on whatever platform you're using to listen or watch. Also, if you're feeling generous today, please leave us a glowing review on Apple Podcasts, Stitcher, or wherever you like to listen. If you'd like to reach out to us with questions, suggestions, scathing criticisms, etc., please email us at psychfrontiers@novamind.ca. Thanks again. The content of this podcast does not constitute medical advice or mental health treatment. Please consult a medical or mental health professional if you believe you are in need of mental health treatment.